Good morning. My name is David Miller. I'm at the business school over at Brenau. I'm the lead faculty for the MBA program in healthcare management. I'd like to welcome you all to Brenau's Downtown Center and our healthcare reform seminar. Now, Kit went over a couple of these things, but I just want to clarify some on logistics basis. First, if you look at your agenda, given our relatively short program, you'll note we will not be having a formal break. So if you need to leave the theater, please wait until one speaker is done and we're introducing the next. If you need to leave early, and you may have to leave early, please consider watching this program from the next room where there's a live audio and video feed. Okay, so if you need to leave it, in a half hour, 45 minutes, consider going over there and watching it live. Okay, this program will be recorded. And the hyperlink will be placed on the Hall County Chamber website in the near future. So we will be recording this, and you all will have access to the content and the speaker's comments. Okay, the last activity of the morning is a panel. It's going to be a question and answer session, as Kit said. If you have questions, please jot them down on the notepads in your folders and give them to one of the attendants that'll be coming. I feel like an airline person, on this side, the aisle deal. Okay, so they'll be going up and down the aisles between speakers. Now, we want you to put your name and email so that we can follow up if we do not get to your specific question. So put your name and email address on your questions. Third, and Kit also mentioned this, please mute or turn off your cell phones. It just, it would be a little disruptive, especially since we are recording this. Okay, today we will be talking about healthcare reform. And as most of you know, for almost a century, presidents have attempted to leave their mark on the provision of healthcare in the United States. From Teddy Roosevelt in 1912, campaigning and eventually losing a call for universal health care. 1912, Teddy Roosevelt. FDR's discussions of a national health insurance program, which was never really seriously considered by Congress. Truman's call for a health care overhaul, including compulsory coverage. Nixon's call for employers to provide a minimum level of health insurance to employees. Right? Sound familiar? Carter's call for a comprehensive national health insurance system with universal and mandatory coverage. Bill and Hillary Clinton's failed attempt at managed competition within healthcare. George W. Bush's prescriptions drug coverage expansion. And finally, on March 23rd, 2010, after a year of really epic debate between Republicans and Democrats, Barack Obama signed the Patient Protection and Affordable Care Act, also known as Obamacare, into law. Now, almost everyone agrees that things had to change. That's almost something that everybody can get on board with. 1973 was a benchmark year. That year, it was reported that it cost GM more for healthcare insurance per employee than steel it put in their cars. And back then, they actually did put steel in their cars. So that was a big deal back in 73. And more recently, the CBO estimated that in 2017, healthcare expenditures would account for 19.5% of our total gross domestic product. And it could rise to 40% by 2050. It was so bad that many were even looking to other countries for solutions. A classic utilitarian philosopher stated, America's healthcare system is second only to Japan, Canada, Sweden, Great Britain, well, all of Europe. But you can thank your lucky stars we don't live in Paraguay. Okay, well, maybe Homer Simpson isn't Franz Kafka, but you guys get the point. People were looking for different models of health care. Now, for you and I, we saw the monthly insurance premium in our pay increase, as were our deductibles and our co-payments. And as a clinician, I saw less and less reimbursement from even the best insurance companies. And don't get me started about Medicare. Now, is the Affordable Care Act the best way to address these issues? Is it financially sustainable? Will it eventually collapse under its own massive bureaucratic weight? Will the House Republicans defund the Affordable Care Act? Will Americans radically modify their lifestyles and make necessary changes for sustainable health? Or will we continue to conduct ourselves like Mark Twain, who said, "The only way to keep your health is to eat what you don't want, drink what you don't like, and do what you'd rather not"? Sorry, not in this life. Now, I'd love to have a symposium that covered those issues, and maybe we will at a later date, but that's not what we're here for today. On October 1st, one of the law's linchpins, the health insurance marketplaces, the health insurance exchanges, should be open for business. And we'll be hearing from a number of experts sharing their views on the provision of health care, its impact on employers, and the health care exchanges. So let's get started. Groucho Marx once said that a hospital bed is like a parked taxi cab with the meter running. Now, fortunately, hospitals and the providers of health care are radically altering the ways in which they deliver care. And I'd like to introduce Mr. Steve McNeely from the Northeast Georgia Health System. Now, it's really a treat to introduce Steve because he's a graduate of the Brenau Healthcare MBA program. As I said, he works for Northeast Georgia Health System in the Financed and Managed Care Division, where he's been for the last 20 years. He's currently the director of the Northeast Georgia Health Partners, a PPO network which serves over 40,000 members throughout the region. He works with employers, brokers, and insurance carriers and has been instrumental in the development of new insurance products currently marketed throughout Northeast Georgia. Let's give a welcome to Steve McNeely.